Hello and welcome. This is a video in the series of publishing in the medical literature. This video will explain the meaning of case series and how to put a case series together. This will be helpful for clinicians who are interested in publishing their articles. So what is the meaning of a case series as they are published in the medical literature? A case series will refer to a type of study design that presents a collection of individual cases with similar characteristics or outcomes. The time span during which these cases have been collected may be variable, and so this is one of the differences between case series and case report. In a case series, a group of patients who share common features, such as a particular disease, treatment, or outcome are described and analyzed collectively. However, there is no control group for comparison. Case series provide valuable insights into rare diseases, unusual presentations of common conditions, or novel treatment approaches. They often serve as preliminary evidence to generate hypotheses or to inform clinical practice. Case series can also be used to illustrate the spectrum of clinical manifestations, treatment responses, and prognostic factors associated with specific condition. Although case series offer valuable descriptive information, they are considered lower in the hierarchy of evidence compared to randomized controlled trials or prospective cohort studies. This is primarily due to the absence of control groups and potential biases inherent in the retrospective data collection. Nonetheless, case series remain an important tool in medical literature for documenting clinical observations, raising awareness about rare diseases, and guiding further research and clinical decision-making. So what are the differences between a case report and a case series? So both case reports and case series are types of observational studies that present information about either one patient or groups of patients. A case report typically focuses on describing a single patient's clinical presentation, diagnosis, treatment, and outcome in detail. Sometimes you may have more than one patient, but typically they are clustered together in a very same time span. It often highlights unique or unusual features of the case, such as rare disease presentation, an unexpected treatment response, such as a congenital abnormality in a baby born after a patient is given certain treatment, or it can focus on a novel diagnostic approach. Case reports are usually anecdotal in nature and generally do not involve statistical analysis or comparison with any other cases or populations. They are valuable for documenting rare conditions, atypical disease presentations, adverse drug reactions, or innovative treatment strategies. Again, as mentioned earlier, case reports are also considered the lowest level of evidence in the hierarchy of medical literature, and therefore they will never be part of a meta-analysis, but can provide important insights into clinical practice and stimulate further research. So the difference between the case report and case series, if we go on, we find that in a case series, it presents a collection of cases. So it's not just one case, it's a collection of cases with similar characteristics such as common diagnosis, treatment, approach, or outcome. At times, these case series and the cases collected in the case series will present over a number of months or maybe a number of years, but there will be a similarity in the diagnosis, in the treatment approach, or the outcome. A case series typically includes more than one patient and provides a summary of findings across multiple cases. It will involve descriptive statistics to summarize patient demographics, which means the age of the patient, whether they are married or not married, which geographic location they come from, if they have any other peculiar statistical information, then this is all included in patient demographics. Clinical features, treatment modalities, and outcomes. Case series offer a broader perspective on a particular condition or treatment approach by aggregating the information from multiple patients. And so they are useful for identifying patterns or trends or variations in disease presentation, in treatment response, or prognosis within a specific patient population. While case series provide more generalizable information compared to case reports, they are still considered as observational studies and are subject to limitations such as selection bias and lack of control groups. In summary, we can say that a case report focuses on an individual patient anecdote or more than one patient, but over a limited time span, whereas a case series provides a broader overview of a number of cases, even over different time spans, offering insights into patterns and trends within patient populations. Both types of studies play an important role in medical literature for documenting clinical observations, generating hypotheses, and informing clinical practice. The question is, if case series and case reports are so low on the hierarchy level as far as medical evidence is concerned, why do journals want to publish them? There are several reasons, and some of them are noted here. So the novelty that they bring to the journal and can attract interest from researchers and from readers. This novelty can enhance the reputation of the journal for publishing groundbreaking content. So for example, probably the first case that was diagnosed of HIV in pregnancy was probably published either as a case report or a case series and led to further kinds of investigations and studies on this particular disease. Contribution to medical knowledge and enriching the medical knowledge as well as potentially aiding in diagnosis and treatment, the potential for gathering citations, engaging content which may be for medical professionals as they offer real-world examples that illustrate clinical concepts and challenges. Case series also serve as valuable educational tools for medical students, residents, and practitioners, helping them to learn about different clinical scenarios and approaches to management. The disadvantages of these publications in journals are that they may have limited impact in terms of the number of cases that may be present in the population. The journals may have space constraints, and so they often limit the number of words that you can use in the publication. And there may be some delays in publication or even rejection because the journals may not get the proper peer review for it in quick time. And so there are often a lot of challenges for peer review. The ethical considerations may be important because cases require informed consent from patient, which can present ethical challenges, especially in cases involving sensitive information or vulnerable populations. So children are considered a vulnerable population. Patients who are disabled, who are not conscious, patients who are pregnant, they are also very vulnerable populations. So that is why the ethical considerations may be a challenge as well as a barrier to being able to publish. Now let us go to a real life and a real world example of the requirements for publications as if you want to write up a case series. So the Journal of the Pakistan Medical Association is a very prestigious journal for this country. And the guidelines for authors in this journal include the definition of the case series, as well as some guidelines about what can be included in the Journal of the College of Physicians and Surgeons of Pakistan is another very prestigious journal in the country, and their guidelines for publication of case series includes some information about the length of the article, which should be around 1500 to 1600 words with 15 to 20 references. And the rest of the format should be that of an original article, which is also provided in the guidelines for authors in the journals and their website. The guidelines for publication are very simple and include the 4 major categories of introduction, in which literature is reviewed, methodology, how the data was collected and how the data was analyzed, the results, and the discussion. However, one must remember that case series is not a very usual methodology as far as research methodology is concerned. So it is very important to have a senior clinical mentor who is part of the group publishing such an article, so that they can offer some ideas about how the statistical methodology should be applied to get the results. So some results may be very straightforward, such as the basic demographics or the clinical symptoms, but if there are other kind of statistics is going to be used, then it has to be thought out very carefully as to its pertinence for this kind of publication. So an example of a case series that was published recently in the medical literature is the title of endometriosis related spontaneous hemoperitoneum in pregnancy. So here the authors have reported 6 cases of endometriosis related spontaneous hemoperitoneum diagnosed in pregnant patients and postpartum patients over 13 years. And this is considered to be an adverse pregnancy outcome. For those of you who are interested, you can go to the journal sites and you can pick up this article and read through it carefully to get an idea about such publications. Another example is an article that was published in 2021, and the title of this is Critical Role of 3D Ultrasound in the Diagnosis and Management of Robert's Uterus, a single center case series and a review. So in this particular case, a septate uterus with a non-communicating hemicavity was first described by Robert in 1969 as a specific malformation of the uterus. This condition is commonly associated with a blind uterine hemicavity, unilateral hematometra, a contralateral unicornuate uterine cavity, and a normal external uterine fundus. The main symptoms are repetitive attacks of pain at 4 weekly intervals around menarche, repeated dysmenorrhea, recurrent pregnancy loss, and infertility. So this is an interesting congenital anomaly, and the authors have published a case series on using 3D ultrasound for the diagnosis and the management. With this, we come to the end of the video. If you like the video, then please press the like button, share with friends and colleagues, send your comments, which we find very valuable. Please subscribe to this channel and support the channel, and tap the bell icon next to the subscribe sign, which will allow you to be notified of future videos. Thank you and goodbye.